conservative state when it comes to its elected leaders. It's no secret, been that way for a while. But despite that commonality, you know how rare it is for all three branches of government to be on total agreement on one topic? Recently, it's been about behavioral health. And since 2020, a new campaign involving state government, local leaders, and community groups, they've worked to address it directly. The Idaho Behavioral Health Council has a simple goal: to support Idahoans with mental illness and addiction, to get them the services they need when they need them. Joe Paris tells us for the last few months, the council has developed a blueprint for doing just that. And now they're asking Idahoans what they need to get it.
A stamp of approval to kick off 2024. Governor Brad Little signed this executive order in January, continuing the existence of the Idaho Behavioral Health Council. Since its creation in 2020, the council has implemented programs like a statewide crisis and suicide hotline, funded new youth crisis centers, and expanded the behavioral health workforce. Crucial work, but there's much more to be done in the behavioral health world. Governor Little notes that in this executive order, that while Idaho has made considerable improvements to the behavioral health system, it is in the best interest of Idahoans for the council to continue their work. And they need recommendations for policymakers to push for continued system improvements. The governor's request extends to the people of Idaho. The Idaho Behavioral Health Council is looking for ideas to invest in, ideas to improve the state's behavioral health system to benefit all Idahoans. So the council is hosting a series of events to hear from Idahoans. In-person events begin this week in Bonneville County, then over to Kootenai County, wrapping up in about 10 days in Canyon County. On August 23rd, though, a virtual event will welcome all Idahoans from across the state to weigh in on how behavioral health, mental health, can be improved. This all leads to a selection of focused recommendations, new priorities for a strategic plan, and that'll happen on September 13th, the selection. And it will focus on ideas like increasing the supply and retention of behavioral health professionals, ensuring robust crisis response systems are available statewide, and reforming the adult and juvenile competency restoration systems. They also want to look at things like expanding community-based recovery services and connections for people leaving incarceration. Stakeholders are showing a real interest in investing in improving behavioral health in Idaho. The question is, what do Idahoans want?
And I spoke on the phone this afternoon with the spokesperson with the council. They tell me that October is when we can expect a good direction in terms of the selections that they'll start making in September. And Brian, we will chat with Idaho Behavioral Health Council when they have their heading and how they will achieve change. This is an important thing, too, because I know that you might just be seeing this, at the end of August. This is a news story. If you fast forward, though, to next year and years in the future, this is the type of survey that makes a difference in the end. We'll hear from Idahoans. How come the government isn't doing this? How come the government isn't doing that? These are the types of public events and public input that make change. So if you're interested in behavioral health, I would encourage you to be involved in this and take a look at it. Again, Brian, as we get closer to October, we will check with the stakeholders to see what they decide to do and what they do with it. The strategic plan that they created back in 2020, it ended up with a lot of changes and new things in Idaho. So this is, I guess, the next chapter of that.
Cool. Thanks, Joe.